Thank you all for joining. It's a pleasure to have you here, especially in the evening. And um, so, as Ms. Rudolph was saying, I'm with Capital Health, with the Capital Health Behavioral Health Specialist team of clinicians. And today I'd like to share with you some strategies to maximize your brain health and decrease your chance of cognitive decline. So, some of the learning objectives we have today is to learn about a number of evidence-based strategies to improve brain health, recognize the difference between the cognitive changes that happen with normal ages versus dementia, and depending on our time, etc. We'll certainly talk about the benefits of meditation mindfulness for brain health. So we have two offices. We have an office in Bordentown, New Jersey, and an office in Newtown, Pennsylvania. And so we're a group of psychiatrists, nurse practitioners, psychologists, therapists, nurses, and we provide diagnostic evaluations, ongoing medication management, also different kinds of therapy, both individual and group, and we offer both in-person and telemedicine appointments. Okay, so almost all of us worry about memory loss at one time or another. Just the other day, I was talking to my son and was trying to recall some common word, and I couldn't come up with it right away. And reflexively in mind, I thought to myself, am I getting dementia? And so many of my patients also worry about memory loss and dementia. And 1 in 7 Americans will get dementia, and it is expected that by 2050, the number will increase by 3 times that amount. So, but we have good news, and that is that we can take steps to reduce the chances of cognitive decline and dementia with the strategies we will review in this presentation. Okay, so memories are not perfect, and we're all going to forget things, and we start forgetting things more and more as we age. So that's no news to you. And you might also be aware that there are changes in the brain that happen as we age. So the brain shrinks in volume, actually, and that the outer layer of the brain that really is associated with learning and memory and also making decisions also thins. And in fact, our connections of the nerve fibers also start to reduce. So these are the things that may be involved in memory and thinking and making decisions, etc. So all these things. And then on top of that, we have reduced blood flow to the brain. So here we have a number of different factors that are working against us as we age that may increase the chance of the cognitive decline. But interestingly, there are some people that actually, if you when they die and then there's an autopsy is done, is that their brain shows changes of Alzheimer's, for example, but they actually function pretty normally. So that's a strange thing. So why is that? This is the concept of cognitive reserve. That is that some of these individuals that have cognitive reserve are really able to switch into a different gear, that even though they're going uphill against the effects of brain damage from Alzheimer's, they're doing fairly well. And how do you build cognitive reserve? That's something that's built over a lifetime of sometimes increased education, of having an occupation that's stimulating for you, engaging with people in social interactions, and always being curious and wanting to learn new things. These are things that can build cognitive reserve. So let's talk just briefly about what's normal and what's not normal. So there's things that are associated with normal aging. And so forgetting things and then remembering them later on, maybe 5-10 minutes down the road, or just even 30 seconds down the road, these are things that are fairly common with aging. And we can make some small mistakes in how to do certain things. We may forget the name of a street, of a place that we go to fairly frequently, or we might forget where our keys are. Then that's something that we commonly do and that may do more often as we age, forgetting where our wallet is. But dementia, when there are some changes, what we may find is that we may have more trouble remembering recent information. I often have patients, take some pride in telling me, Dr. Vyas, I am forgetting things, but the things that I know so many other things from the past that I can recall. And so they often don't realize that it's the long-term memory is fairly preserved when it comes to normal aging, and with dementia, but it's the recent stuff that starts to change first. And then we may start getting some difficulty in problem solving some things. For example, how to use our phone, like our smartphone, the way we used to know how to do that, or things that are concerning, like not remembering how to get home, or a familiar place that you go to frequently. Now, forgetting where your wallet is one thing, and that may be normal for many of us, whether with aging or not. But putting your wallet in the refrigerator is an entirely different thing. And so those may be signs of something more than normal aging. And actually, the cognitive decline is really on a spectrum. And so we have the normal forgetfulness with aging that we just talked about. Here, the things that you do on a day-to-day basis, the everyday tasks, and your functioning is well preserved. And so that's not an issue. With dementia, what we have is that we have actually reduced functioning in the sense that some of the everyday tasks that you do are often impaired, and there's greater, of course, memory loss. And interestingly, when I have people come in that often they come in for things, mental health conditions, of course, like depression, anxiety, etc. And they incidentally tell me that, Dr. Vyas, I am also having some concerns about my memory and I'm forgetting things. And these individuals typically are ones that actually don't have much of a memory impairment or may have mild cognitive impairment. The people that have dementia are often the people that family members bring in, and they actually don't have any real awareness that they're having as much difficulty as family members think that they are. So that's the spectrum. And so let's talk a little bit more about some of the different kinds of dementias. And we're going to go through these fairly quickly because I really want to get to the strategies as to how to decrease your chance of cognitive decline. So one of the things is that if you have mild cognitive impairment, the kind of impairment that we talked about in the middle between the normal aging and the dementia, is that here everyday functioning is pretty well preserved. But when you go to see a doctor, whether you see your primary care doctor, you see a neurologist, or see somebody like myself, when people say that they have memory concerns, we often bring out a couple of paper pencil tests that give us a pretty decent idea if the cognitive impairment is significant or not. But if there is some cognitive impairment, I think we commonly recommend that people have follow-up for that, like 6 months or a year down the road, just to make sure that there isn't any significant progression. Alzheimer's disease, as you know, is the most common type of dementia. And in the amyloid plaques and neurofibrillary tangles, which are characteristic of this disease, progress as the disease progresses also. There is a bit of a hereditary component in the sense that there's a fourfold risk if a parent or sibling has Alzheimer's disease. Now, there's lots of good news around the corner in the sense that we already now have a couple of medications that can slow cognitive decline in Alzheimer's disease by maybe 25 to 35%. And these are FDA approved and covered by Medicare and recommended for those with significant impairment. And these are given essentially for people with mild cognitive impairment or mild dementia, not people with normal kind of aging-related dementia. The thing is that it's given by an IV infusion over 2 to 4 weeks, but it does have some significant adverse side effects, including brain swelling and bleeding. And so, the neurologists that I've talked to at Capitol Health, most of them are not like prescribing this in any kind of significant quantity. And, there are certain kinds of people often ask me, are there natural remedies that I can use that can help me decrease cognitive function? And so I'll speak to that a little bit later in a slide, but I do want to address some people do try ginkgo biloba. And there was a study of about 3,000 individuals over the age of 75 who were followed for 6 years. So that's quite a long study, but there was no statistical difference in the rates of dementia in those individuals that took that. So other kinds of dementias include vascular dementia. This is one where people who've had strokes or many strokes from cardiovascular disease, etc., may then get dementia. Here, Alzheimer's dementia tends to progress rather slowly and gradually. Dementia from vascular dementia may sometimes, if you have a stroke, may actually progress rather quickly because of that. There may be a sudden decrease in cognitive functioning. Other kinds of dementias are dementias with Lewy bodies, and here you not only have cognitive impairment, but you may also have, have motor symptoms like you have in Parkinson's disease, and even strange things like visual hallucinations. Frontotemporal dementia is one that actually can mimic psychiatric illness in the sense that that person may have behavioral or personality changes that also occur and some inappropriate behavior. And these are also the kinds of individuals that come to our attention. Actually, all the types of dementias often at some point there may be some behavioral changes, and that's how psychiatrists end up seeing them because we're managing some of those other conditions that they may be experiencing. And in Parkinson's dementia, about a third of the people with Parkinson's disease will develop dementia. So an MRI may show areas of brain shrinkage, what we call atrophy, and even more advanced studies like an amyloid PET scan may detect, things such as the beta amyloid in Alzheimer's, and more invasive things like a spinal tap, a lumbar puncture may also help diagnose dementia. But blood tests are being refined to detect beta amyloid, etc. And there's a simple blood test right now called Persevity 82 that measures levels of amyloid and tau proteins and is about 90% accurate in detecting Alzheimer's. Has been developed in the US, but not yet approved by the FDA, and not necessarily covered by insurance. So, and it's less accurate for those people in the early stages of cognitive impairment, but more accurate when a person has dementia. So sometimes the utility of this, may not be high in the sense that if you're already detecting dementia, you don't necessarily need a test to confirm that. And the cost is, about $1,200 or so. Okay, so now the good news. The good news is that almost 50% of dementia cases can be delayed or prevented. And this is huge when you think about it. We're starting to think, we used to think that that things such as Alzheimer's, dementia, etc., were things that we just had to it was one of those things that we were either fated for, and that's what happened, and that we really had no kind of chance of improving our odds with that. And now we're realizing that just like cardiovascular disease, dementia is also something that we can actually take steps to right now to decrease our chances. So I really love this slide because, it says heal thy body. So it's a healthy body is equal to a healthy mind. So by healing our body, we can also heal our mind. Because of the mind-body connection, many of the interventions, surprisingly, to improve brain health are ones that also promote a healthy body. So the Alzheimer's Association has come up with essential ingredients for brain health. And we're going to go through these each in turn, but let me just itemize them for you now. First, it's, for example, regular exercise, stress reduction, eating a healthy diet, getting enough sleep, staying mentally active. Other ingredients for brain health include maintaining a healthy weight, being socially connected, taking care of the medical conditions you have, especially the chronic medical conditions that you have, simple things like avoiding health trauma. Especially one of the things that is very important is to avoid falls. And if you have a fall and you have a head injury, that can significantly then increase your chance of dementia. Treating mental illness is very important in terms of decreasing your chance for cognitive decline and treating hearing or vision problems. So let's go through the things that we can change. One is essential ingredient number one is exercise. So, there are many benefits, numerous health benefits for exercise, and we all know that. But the important thing for this presentation is that it can decrease your chance of developing dementia. It also has other improved benefits, such as improving insulin efficiency, reducing bad cholesterol, things like that, improving sleep. So, in a study of 191 women for a duration of 44 years, imagine for 44 years, 191 women were followed, and those women with a high fitness level at midlife had an 88% less chance of developing dementia and delayed the onset of dementia by 11 years. That's staggering. But even small things that we can do, even those people who walked at least 3,800 steps a day had a 25% lower risk of dementia. Now, even though the ideal is 150 minutes of moderate intensity activity during a week, any kind of exercise is better than none. And especially good to remember is that long periods of sitting may contribute to cognitive decline. So get up and get around throughout the day. Now, there are benefits, again, of exercise on the brain. Imagine increasing brain volume, increasing the size of the hippocampus, the area that's involved in memory, decreasing some of the changes that happen with age in the brain. Of course, reducing cardiovascular disease, and that's often the reason that we do exercise. But again, as we said, it can reduce the chance of dementia or delay the onset of dementia. Okay, so what is surprising to people sometimes is that exercise has an antidepressant effect. In fact, I commonly ask people who come to see me who do complain of depression whether they're exercising, because this is a natural thing people can do to feel better. And in fact, this has been validated in studies that exercise can decrease depression on validated rating scales. And this may be related to a release of, for example, endorphins and serotonin. As you might well know, one of the most common types of medications, group of medications that we use for treatment of dementia are the SSRIs. And these actually increase the amount of serotonin in the system. And imagine exercise also increasing serotonin in your system. So I'm not advocating that this be a treatment for depression, because depression itself often needs the help of therapy and medication, etc., to have the full effect. But you can certainly help yourself by exercising. Another surprising thing is that yoga has a profound effect on physical and also on mental health and stress reduction. And while it has those kinds of positive effects, it may also improve memory and cognitive functioning. Okay, essential ingredient number two, stress reduction. So we're going to go jump right into reducing stress with a short, deep breathing exercise. And again, we talk about the mind-body connection. And the mind and the body are often disconnected in our lives, in everybody's life to some extent or another. And the breath is an ideal way to bring them into connection, both the mind and the body. And so mind is often stuck in past regrets or future worry. Rarely do we find ourselves in the present moment, which when we breathe, we consciously bring ourselves into the present moment, which when you think about it is the only moment that exists. The past doesn't exist and the future doesn't exist. What we have right now is all that really exists. So we're going to take a 5 deep abdominal breaths. Now, don't start doing that yet. Now, let me just tell you a little bit about abdominal breathing. Abdominal breathing is really the way the babies breathe. As we get older, what we do is that we breathe from our chest kind of shallowly, and we don't take deep abdominal breaths. We start actually much more helpful in terms of the stress reduction. So what I want you to do right now is to really close your eyes. If you're comfortable, you can keep them open if you're not, but close your eyes. And I want you to just sit. I assume you're sitting in a chair or on a couch or someplace like that. I want you to sit comfortably. And now, just I'm going to do this with you. And actually, I was doing this a little bit of this before we started the presentation. So we're going to just close our eyes. And now we're going to start the abdominal breathing. Now watch how the belly rises on the inhalation. So take a deep breath in, and you can feel the belly rise on the inhalation, and then and fall on the exhalation. Just take some deep breaths now. Now let's do this on your own, and I'm going to do it with you. Hey, so the other day, many of you probably, like myself, have one of those smartwatches, and they're sometimes too smart for us, and they'll kind of tell us when our heart rate is high or whatever. And I noticed one time I was just kind of checking, and I saw that my heart rate was elevated. And so I did this exercise, this 5 deep abdominal breaths, and would you know it, my heart rate went down more or less within the normal range within just a couple of minutes by doing this exercise. So this is something that you can do at any time of the day when you're feeling stressed. And again, if you have one of those watches that smart watches, it can ping you every hour. So you can do this kind of exercise every hour if you like while at work. And this could reduce the stress level in your day. So Merriam-Webster defines stress as bodily or mental tension resulting from factors that tend to alter an existing equilibrium. That's kind of a mouthful, but let me give you an analogy. Imagine that you're going to work in the morning, or maybe even going to the store, the grocery store, and then suddenly you're at a red light, and suddenly you're hit from behind by another car. Now that what you just experienced is a disturbance in your equilibrium. So, and this is stress. And how you respond to it can make all the difference in the amount of stress your body and mind will experience that day. So you can get out of the car and be kind of really upset and angry at the other driver, etc. Get all worked up about it. Or you can take a few deep breaths like we just did. Be thankful that no one was hurt. Approach the other driver in a friendly manner. Get the information that you need, all that insurance information, etc. But the way that you respond in that moment is going to make a difference in how the rest of your day is. Either it's going to end up being a stressful kind of a day, or it's going to be a day that you had some stress, but you responded to it appropriately by using a stress reduction strategy. So anyway, our stress response system is really pretty complicated, and really all I want to say here is that it's really interaction between our endocrine, immune, and nervous systems. So, about 2/3 of the visit to primary care may be related for stress, maybe for stress-related conditions. Aging itself then is an additional insult to injury in the sense that it also causes an increase in the stress hormone cortisol. And cortisol is associated with poor cognitive performance and shrinkage of areas of the brain associated with memory. And so now I want to tell you about the fact that we have both chronic and acute stress, and we're going to get that in the next slide. But let's just be very clear. Stress affects almost all the major organs of the body, and it can aggravate or precipitate illness where there might not have been any illness or disease that might have happened. So stress um, to reduce your stress is a very important part of health and decreasing cognitive decline. And depression and anxiety can also increase the risk of cognitive impairment. And we'll talk about that a little bit later. So let's go to the concept of acute stress and chronic stress. Our body was evolutionary designed to handle acute stress. You know, the proverbial kind of the lion or tiger in on you know, in the woods or on the Serengeti plains, if you're like a deer or a gazelle. And so the body responds well to that. And in our lives, acute stress may be things such as being pulled over by a cop for speeding, maybe losing a loved one, maybe, having a fall and maybe, twisting your leg or twisting your ankle or something like that. Things such as having an argument with a spouse or loved one. These are the kinds of acute stress that we experience. But it's the chronic stress that's really debilitating for us. Chronic stress, such as the chronic health conditions that we may develop, especially as we age. Having to take care of a loved one who is aging, that kind of a thing. Maybe being in an unhealthy relationship, financial difficulties, etc. These are the kinds of chronic stress that we deal with. And how we handle chronic stress is very important for our overall health. So let me give you an analogy between chronic and acute stress, even more tangibly, hopefully. So imagine that you have a bucket of water and you pour it on the ground, and with time, it'll dry up. But now imagine a steady trickle of water on the ground. Not only will it not dry up, you may have a veritable pool of water there. So that's an example of chronic stress. Essential ingredient number 3, eating a healthy diet. Um, So I want to introduce the concept of chronic inflammation. I'm sure you've heard about the inflammation. That's really a lot of people talk about inflammation, and there's here again is a tale of two cities: acute inflammation and chronic inflammation. Just like we talked about acute stress and chronic stress, it's the chronic inflammation that is really harmful for us. Acute inflammation actually can be helpful. Let's say you get a cut, and if you get a let's say cut in your finger, the body is great at sequestering different kinds of things that are going to help, repair that cellular and tissue damage. But chronic inflammation actually causes that kind of damage, and it can be a cause of a number of different kind of conditions, such as heart disease and diabetes, and itis diseases like colitis, arthritis, and importantly for us, things such as Alzheimer's. Um, So how do we decrease chronic inflammation? Well, our diet can be a very powerful ally, or it could be a powerful enemy for us. So um, anti-inflammatory diets of foods actually promote a healthier, more diverse gut microbiome, the mix of microbes in your gut. There's some evidence that those individuals with a healthier microbiome from high fiber foods or probiotic foods such as yogurt may actually live longer. Also, exercise, how some of these things kind of all work together. Exercise may actually promote a healthier microbiome in the gut and reduce inflammation in the gut. So pro-inflammatory foods we know are the ones that are the highly processed foods, the sugary foods, the refined carbohydrates, saturated fats, trans fats, things such as that, certain processed meats. These are all pro-inflammatory, causing inflammation. And anti-inflammatory foods are often the ones that we're told to eat, but we often don't get enough of, such as the fruits and the vegetables, for example, certain whole grains, certain kind of fish, fatty fish, nuts, etc. These are all anti-inflammatory. So unfortunately, our Western diet is really uh, uh, is upside down. We're going here in this slide, we compare the Mediterranean diet to the Western diet. And you can see the Western diet is the reverse of the pyramid, which we should be having. In the Mediterranean diet, which we'll talk about just briefly, is really what you have is whole grains, fruits, vegetables, all those kinds of things are at the bottom, the base of the pyramid, the largest part of the pyramid. And the sweets and the processed foods and things like that. Fatty foods are at the top, the smallest part of the pyramid. And in the Western diet, it's the reverse. So what we want to do is to get to a pyramid that's more like the pyramid that we see on the left, not the right. Now, interestingly, the Mediterranean diet is a very good diet, but there is also a diet for called the MIND diet. It's a cute acronym, but it basically stands for Mediterranean Dash Diet Intervention for Neurodegenerative Delay. Basically, neurodegenerative delay meaning cognitive decline. So the kind of diet, the MIND diet, includes the Mediterranean diet plus the DASH diet, which it was originally developed to help decrease hypertension, and it limits sodium intake. And so the MIND diet also has some variants on the Mediterranean diet, such as restricting cooking oil to olive oil, eating generous amounts of berries. It also asks you to have 4 servings of beans per week, a couple of servings of poultry, a couple of servings of fish a week, and all the other kinds of recommendations for the general Mediterranean diet. So uh, in summary, the Mediterranean diet is probably the best research for overall health, and this MIND diet may be the best to decrease the chance of cognitive decline. People often ask me about nutritional supplements, and to get to the punchline, there's not much good news here. The thing is that many of the nutritional supplements that people take have really not been found to have a significant effect on cognition and cognitive decline, even though the claims are really very robust when you see it on the label of whatever kind of bottle that you have. Um, there's very few studies to show that it has a significant impact. And and this is kind of sad because this is a multi-billion dollar industry. And the reason that we have all these different products that are advertised, that are on the market, the reason is that there's no control the FDA has over this. So you can make claims as long as you don't make a claim that you're going to treat a disease. So if it makes a claim that it's going to treat Alzheimer's disease, it has to be something. It's something that the FDA has to, in a sense, can weigh in on. But the thing is that if you say, it improves brain health, well, what's brain health, right? So I mean, it's all these other things that we're talking about, but it's not a condition per se, right? So it's not like saying that it's improving Alzheimer's or it's improving some other thing. So because they can put anything like that on the label, they don't have to have any substantiation. It could be Dr. Vyas's special concoction, and if I have the marketing skill and the entrepreneurial skill, I can put it out on the market and say that it does various things. Now, there are a couple of things that can be helpful, and one of them is actually multivitamins. It's surprising. There was an analysis of 5,000 people over age 60, and that it demonstrated that those who took multivitamins daily, multi mineral kind of supplement daily, slowed down cognitive decline by 2 years. Omega-3 fatty acids in fish oil is generally, for the general population, is not recommended, but those people with a certain kind of gene that may be an increased risk for dementia, for Alzheimer's, may benefit from those kind of supplement. Okay, so we're going to talk about essential ingredient number 4, getting enough sleep. So some of us pride ourselves in how little sleep we believe we need to function, but that's at the price of bringing on or worsening disease. So memories are really consolidated during sleep, and a good night's sleep also helps you be more focused and alert during the day. So as we age, we tend to sleep less. And so for seniors, that makes this even worse. It takes greater effort to get enough sleep. And what happens is that many of my patients use over-the-counter prescription sleep medications to try to help with sleep. But those should only be used for a short term because in the long term, they can impact memory and cognitive functioning. Sleep aids often contain diphenhydramine, which is a compound found in over-the-counter medications such as Benadryl, ZQL, Tylenol PM, and others. And when you see the commercials on TV, they sound so innocuous, right? I mean, it's like it's so natural and innocuous to take ZQL. But these have anticholinergic properties, and and this may increase the risk for dementia in the long term. A study published in the Journal of the American Medical Association Internal Medicine in 2019, involving 3,400 individuals aged 65 and over, showed that taking anticholinergic medications, such as the over-counter medications that we talked about, for 3 or more years, had a 54% increased risk for dementia. So anticholinergic agents are also found in some of the kinds of medications that some of the properties, anticholinergic properties, are also in agents such as the benzodiazepines. These are agents that we commonly, the Xanaxes and the Ativans and the Klonopins. Many people have been used to taking them for a long time for their anxiety. And, decades ago, this was commonly prescribed, and many of these individuals still commonly take those medications. So I tend to have a talk with them about some of the risk and benefits of doing that. The other thing is that sleep medications can also increase your risk of falls by 50%, which can increase the risk of head trauma, which we talked about as a risk for dementia. So sleep disturbance not only increases inflammation, which can contribute to various health conditions, as we talked about before, but it's also important that if you have a condition such as sleep apnea, that you get that diagnosed and treated. So what does the American Academy of Sleep Medicine recommend? They recommend that we get 7 or more hours of sleep. And the American Heart Association has also considered that one of the 8 essential ingredients. And now we just said that the Alzheimer's Association has also said it's an essential ingredient for health. But unfortunately, 1 in 3 of us does not get enough sleep. And now, sometimes some of us don't get enough sleep during the weekdays, and so we make up for some of that during the weekend, which is better than nothing, but it's still not the same thing as getting consistent sleep daily. Okay, essential ingredient number 5, staying mentally active. So it's interesting that the things that are going to improve our brain health and maximizing our brain health, we're just getting to some of now the brain stuff, right? At this point, a lot of the stuff that we talked about are things that we're going to be doing to help our body because of the mind-body connection that we talked about. Okay. So there's a lot of mental activity, brain activity that happens when we engage with other persons in a social context, reading their face, the social cues, responding to them. And this enhances neural connections in our brain. So loneliness and a feeling of being isolated then actually increases the risk for dementia. We talked about the higher educational attainment and lifelong learning, etc., building up a cognitive reserve. But things, even if that's not something that you've done now, there are things that you can do in the present. So the thing is that by just meeting with new people, staying socially connected, even doing things like crossword puzzles, even playing video games with your grandchildren or children can be helpful. Learning new things, especially, let's say learning a new language. You've always wanted to learn Spanish, but you've never really, you've never had the time or, to do that. Now, this is a good time to do it. for example, um, you know, you played piano when you were young, but you really haven't done any of that recently. Dust off that piano and get to it again. And this will help your brain. If you're working, that's a stimulation. Your brain is stimulated when you have to work with a lot of people. So that's a positive thing. So if you're working and mentally active and you like your job, no reason to give up your job. Okay. There's certain things that can help also enhance memory. Um, Practice makes a big difference. We talked about practicing, for example, like the piano, learning a new language. All of these things can improve your memory. Any kind of repeated skill, practicing that can be helpful. Um, Many of us are want to like the idea that we can multitask and do a number of things at the same time and be pretty efficient at it. But actually, as we age, our ability to multitask is decreased. Um, and so single tasking is actually better, concentrating on one thing at a time and finishing that one thing rather than going from one thing to another. Another technique is called the pause, link, and rehearse technique. So imagine you're trying to learn somebody's name, remember somebody's name. When you're introducing that person, take a pause and connect their name and face and do that. Rehearse that name, face things about 3 times, and that can help you remember things. And this is just not with names or things like that. You could do it with other things. For example, if there's a certain thing on your smartphone, uh, that you're just learning new, you can do that kind of a thing, pause, link, and rehearse, and that way you can embed that memory better in your brain. Another thing that's helpful is to review your day. So by taking an inventory of your day and trying to then say, oh, these are the things that I want to remember. Especially if you've had a nice memory or things that happened um, at work or whatever else, and things you want to remember or somebody you've met, kind of going over that and writing down the things that you want to remember can help embed some of that better. Okay, it's very important to recognize depression because untreated depression increases the risk of dementia. And treating it can improve your memory and concentration. In fact, there's a kind of a condition which we call pseudodementia. That means it acts like dementia in the sense that you're forgetting things, etc. You're not able to concentrate. Um, uh, which makes a person think that they may be having that kind of issue when they actually may be depressed. So poor concentration, memory issues, difficulty making decisions, all those things be actually part of depression. Things that we think may be part of, we kind of maybe dismiss as part of aging, such as maybe not having as good an appetite, having the dwindle, so to speak, etc., sleeping excessively. These may actually be part of depression. Um, and as as people age, as we all age, the thing is that we may have experienced people our age and older starting to you know to pass away. And then it's natural at those kinds of times to think that, oh, that the grief that we're experiencing, etc., is natural. But normal grief and depression are different. And so there may be some concerning kind of symptoms. And so it's important to get that treated, not just for the mental health, but for our brain health and cognitive functioning. This slide is what I call no-brainers, right? These are things that we know, and we should and can have a significant impact on cognitive functioning if we address it. Things such as keeping a healthy weight. In fact, keeping a healthy weight in middle age can reduce the risk of dementia later in life, especially the weight around the gut. Especially men tend to have that, and that can be associated with diabetes, heart disease, which can also increase dementia risk. Um, a study of men and women in their 60s, for example, found that those individuals that were obese, uh, who were obese had lower brain volumes and had accelerated aging by almost a decade. Um, and simple things, not so simple to actually to put into practice, but very things that we're told over and over, such as smoking, can actually have an impact on cognitive decline. Alcoholism um, a known risk for dementia, but how much is safe to drink? The jury's still out on that. But basically, moderate drinking is considered 2 or more drinks a day for a man and one or 2 or less, I'm sorry, for a man and 1 or less for a woman. Um, but you know, if you don't drink, uh, don't start drinking for health reasons, because a large recent study really said that maybe no amount of alcohol is entirely safe. So if you don't drink, don't start. If you do drink, limit your drinking. Elevated blood pressure, that's another risk for dementia, maybe risk by increases the risk by 30% or so. Head injury is another risk, so protect your head. Okay. So I'm going to go through the next few slides a little more quickly because we're kind of approaching the top of the hour. So again, these are things that we often don't address and can easily address and decrease our cognitive risk. In a study of older adults with moderate to severe hearing loss, those whose hearing was corrected with hearing aids decreased their chance of dementia by 32%. And see, not being able to hear also causes an increase in social isolation, because you're not able to hear, and they're distant, you're not following the conversation, etc. That again decreases the risk for dementia. So by age 80, almost 70% of the people have some hearing loss, and so it's important to get that corrected. Also, vision, decreases with, for example, with aging and with things such as cataracts, etc. Improved vision also decreases the chance of cognitive decline. And with better vision, we can see better, we can communicate better with people, we can read their faces better, also have more social connection. Okay, I wanted to tell you, there was a study, I want to talk to you about the brain, McCann's brain care score. And I know that this slide is kind of, you might not be able to read the writing, so I'll go through this with you in a little bit. But this was a tool that was based on research on 400,000 individuals, adults aged 40 to 69 in the United Kingdom Biobank. And this was developed by Massachusetts General Hospital. And it measures your choices in the physical, lifestyle, and the socio-emotional realm. And the higher your score, the better brain health you have. And so even though we may not be able to, we have a certain score that we get, the idea is to improve our score, do the things that we can to improve our brain health. And so there are things that are measured on this, such as physical things, such as blood pressure, blood sugar, your things such as your body mass index, cholesterol, etc., on the physical realm, and things on the lifestyle, such as nutrition and the diet that we talked about. That's measured. So we talked about physical things, such as exercise and all that, which can impact your blood pressure, your blood sugar, etc., your cholesterol levels. Things in lifestyle, such as nutrition, um, uh, alcohol use, smoking, etc., exercise that you get, and sleep. Those are the things that are present in the lifestyle realm. And in the socio-emotional realm, things such as the stress level that you experience. That's why we talked about stress reduction. Social relationships and having connections with people, that's very important. That's on the scale there too. And even things such as the meaning of life, whether you have a purpose in life or whether you feel like your life doesn't have much meaning. These are all addressed on this thing. And this is something that you can download from the internet. So I shared this with another group and it was a live group, so I was able to give them a handout. I'm sorry, I'm not able to do that, but you can download this if you want and actually rank yourself. I mean, give yourself a score. And there's a way if you go to, if you just Google this and go, you can actually do the survey online and it gives you a score. Okay. Okay, so we're at the top of the hour here. So I'm going to just go through let me just ask our moderator, Ms. Rudolph. I'm just thinking if it's okay with you that I'm going to go through the meditation and the brain changes slide. The meditation mindfulness slides pretty quickly, and then we'll give ourselves a little time for question and answers if that.
Yep, that's great. Sure.
Yeah.
Thank you.
Okay, sure. Great. Okay, so meditation actually helps in learning and memory and actually increases areas of the brain, the gray matter volume in the brain. And there have been studies that are done using mindfulness-based stress reduction in a classes, for example, 8-week classes that they've done. They've demonstrated this. And really meditation is really a very helpful way to reduce stress and also improve and can have benefits in terms of cognitive functioning. And you can even get benefits in a short-term basis. But the ideal is, if you can, 15 to 20 minutes twice a day from morning to evening, if possible. You can start out very slowly by 5 minutes a day if you want, and just kind of get used to that. And the benefits, as we said, improve cognition, decrease depression, anxiety, things such as chronic pain. And so, we use the word mindfulness a lot. That's really kind of in vogue. But what is that? A simple way of thinking of mindfulness is that it's the opposite from forgetfulness. It's being aware. That's what mindfulness is. So we can make be mindful in the everyday activities that we do. For example, even eating our lunch mindfully, going to work, driving our car mindfully. All these can be things that can help reduce stress in our lives. So the benefits of mindfulness are similar in what we talked about in terms of meditation. So let's go to the key takeaways here. So what is good for the body is good for the brain. Again, the mind-body connection. What is good for the heart is good for the brain. What we eat and how we sleep affects our brain health. How we manage stress affects our brain health. Lifelong learning, social connections improves our brain health, and taking care of things such as chronic medical conditions, mental health conditions, improving our weight, etc. These are all things that can improve brain health. And mindfulness and meditation can improve cognition, memory, and brain health. So I want to end there and turn it over to you, Ms. Rudolph, if there are any questions that the audience
Sure.
has.
Thank you very much. Wonderful presentation as always. We did get some questions, so I can read them off. I want to know how to handle the stress caused by the recent election results and how to handle the resulting actions that will occur.
Well, I think half the nation is trying to handle the stress, right? So the thing is that and really this is a very serious question, really. It's not one I can just dismiss because many of my patients are coming with that kind of concern right now. They're saying, Dr. Vyas, this is really a big stress in my life. And I think the thing is that there are certain things that I feel are not helpful, and this is um, and these are things that I've tried to do myself. Is really disconnect a lot from TV, social media, etc. Because there's no good news around the corner, right? For many people, if it's not the elections, it's something else, right? It's something else so that has really helped me in the sense of uh, you know, uh, trying to decrease my stress level because you're getting input and then you have to deal with that input, right? And once that input is there, it's much harder to deal with that than not to just have that input in. So it's not trying to be a hermit or having your head in the sand. It's just being smart. So that's one thing you can do. The other things that you can do are the very things that we talked about here today. Decreasing stress. We talked about mindfulness, meditation. We talked about sleep. We talked about exercise. We talked about nutrition. All of these can decrease stress that's coming from such a thing as the election results and your worry about how that's going to turn out. So that's what I would recommend.
Is it okay to take melatonin?
Yeah, I think it's generally okay to take melatonin. The thing is that we don't have a lot of studies on melatonin, so I do say to people who have sleep kind of issues that um, that uh, that it's relatively safe to take melatonin. I generally tell people not to take more than 5 milligrams of melatonin. Um, you know, uh, and try to address what it is that is causing your problems with sleep. That's even better than taking melatonin. But if you need to, I think that's relatively safe as opposed to taking such things such as Benadryl, ZQL, things like that, Tylenol PM.
Does melatonin contribute to dementia?
Not that I'm aware of at this time. Certainly, that's one of the great things of our science and our knowledge. We're always coming up with things, what we thought, for example, sometimes, this whole thing about how much alcohol, etc., that's gone back and forth, a number of times, so keep posted, on that.
What vitamin is best for the brain, like vitamin B1 or 2 or B12 or B complex or other? And what is the average dosage? Thank you.
Okay. Well, I think that what I can tell you is this, is that in short, as I shared before, the thing is that unless you have actually a nutritional deficiency and there's a reason or a medical condition that then affects, for example, certain nutrients in your vitamins or minerals in your body, there really is no big advantage to taking any of these kinds of supplements. And in fact, some of the supplements can interact with medications you may be taking. So I think that I would say is that first, if you're concerned, if you want to take supplements, talk to your doctor. I already mentioned to you, multivitamin, multi-mineral supplement has been shown to be helpful. So I would stick to the basics there rather than trying to figure out what mega doses you want of certain vitamins, which actually may be harmful.
Over the past couple years in the fitness community, there are allegedly multiple studies that show the cognitive benefits of creatine. Any truth to this, or is it just fake news?
Um, the There is any of most all of there's many nutritional supplements that have been studied. And to my knowledge, there have not been, except for a couple of things that have been actually helpful. So the thing is that I would be careful about uh, about any of those kinds of supplements and the claims that they have. And if you're concerned about it, I would talk to your doctor about it. And also then they may be able to share with you any kind of interactions or with any other medications or things that you may be taking.
How do we get a copy of the recording of this session? I did put it in the chat box higher up if you kind of scroll up, but I will do that again before we leave tonight. Can you comment on the potential benefits on brain health from sauna and cold plunge?
Say that again, Ms. Rudolph.
Can you comment on the potential benefits on brain health from a sauna and a cold plunge?
Okay. Okay. That's what I thought I heard. I don't know enough about that to make a comment on that, so I'm gonna pass on that.
Okay, I'm just actually copying that. Let me put the recording in when in case that person wants to leave. Put it in here. So it should pop up.
I just want to say, some of these things, it's important to stick to the basics, right? The basics, these things that are evidence, everything I shared with you has an evidence base behind it. So if it's better, if you're not for example, if it's better to modify your diet or exercise, then maybe try something that you think might be helpful and we don't have enough research on.
What about valerian?
Uh, well, I think, people use that in terms of for anxiety and things like that. I don't know that it has any, kind of uh, benefit in terms of brain health and cognitive functioning, to my awareness.
Do antidepressants and or anti-anxiety meds contribute to cognitive decline?
Yeah, we talked about the anti-anxiety medications such as benzodiazepines, such as Ativan and Xanax and Klonopin and those kinds of medications can contribute to cognitive decline if taken on a basis.
And how about antidepressants?
No real antidepressants that I'm aware of that has an effect on brain functioning in the long term. We've had these antidepressants. Now, some of the newer antidepressants we don't have enough data on, but the ones that many people take that have been around for decades, people have been around on it for decades, and without necessarily a concern about cognitive decline.
Okay, let's see what the next one is. Um, is it unhealthy for the brain to sleep with the TV on?
Well, I think no, I think I wouldn't say. I mean, if some people actually do find that, I just had a patient the other day that tell me, it's like Dr. Vyas, that TV is helpful for me to go to sleep. If it helps you go to sleep and your eyes are closed, and I'm not aware of any studies that would say that it would be unhealthy to have it. Now, of course, TV and things like the smartphone, et cetera, have that kind of blue light, et cetera, which can impact kind of going to sleep, et cetera. But I'm not aware of any studies, to my knowledge, about impacting that way.
Can we get a copy of the slide handouts? I know we had discussed that. We will have the recording that will be available. Doctor, is that what you'd be most comfortable if we share the recording?
Yeah, I think so. If we can share the recording, that's fine.
Okay. Yeah, so I've just put the recording link in, and as I said, that should be posted within the next 2 weeks, I would check. Um, let's see. Does Prevagen help?
The studies have not really, I don't think has borne out things such as Prevagen, and Prevagen again is an example of an agent that is used, and it's widely available, etc., and it has these claims. Um, now here's the thing I want to say. I don't want to poo-poo some things that are helpful for you. So I do want to say this is that, you know, these are studies that take a population of people. So that doesn't mean that a particular thing may not be helpful for you as an individual. So I do want to just say that because some people do find that some things help. And if it helps you, uh, then that's fine with taking it. But do make your doctor aware because some of these things can interact with other medications and other supplements too. So that's the important thing. Because if a cold of a sauna and a cold plunge helps you, I think then why not do it? I don't think there could be any harm. But but these are studies in general. So we're talking about evidence-based things in this lecture.
What is white matter brain disease, and can it lead to dementia?
Yeah, the thing is that uh there's the things that are involved with white matter is basically the nerve fibers, etc. And if you have a decrease in those things can be an increased risk for dementia. Yes.
Does hydroxyzine 25 milligrams help for sleeping? Thanks.
It is something that can help with sleep, and I actually prescribes that for people that do have difficulty with sleeping, with the understanding that if they're able to sleep without it and find other ways to do that, that's better. But I do find in a number of my patients, they have such a difficulty sleeping that I have to try things. And sometimes that hydroxyzine 25 milligrams is all they need. But do also understand that that we don't have data, long-term data on the use of some of these kinds of things. So what I tell people is that, if we can use it for a shorter period of time, that's better.
Next one. Someone put up the link for the McCann Center for Brain Health, Brain Care score. That's helpful. Thank you. Does plugging in your cell phone close to the bed where you sleep affect your brain?
I don't think plugging it in does. I do think that if you're looking at the phone, I think that certainly can affect sleep. I don't know of any studies and about having it close to you affecting brain health. There might be something out there that I'm not aware of. Certainly, we invite any of our audience if I know, I don't know, Miss Rudolph, if that's possible or not, but certainly happy to learn from you if there's something that you've read that substantiates that.
I have not. I have heard that rumored, but I haven't seen studies. So yeah, I don't feel like I could do that. I could answer more about foods that help me,
No,
but
I was thinking of the audience in general, is that if
oh,
there's
the audience.
something, yeah,
Oh yeah.
yeah.
Yeah, they could put that in if anybody knows that information, you're welcome to put it in the chat box. That'd be fine. Thank you. Um, diphenhydramine 15 milligrams. How would that be for?
Diphenhydramine usually comes, I think, in 25 and 50. There may be another formulation that comes in 15 milligrams, but the thing is that that's what is Benadryl, basically. And so the thing is that that is something that can impact cognitive functioning long-term use.
So thank you so much, Doctor. We really appreciate it. It was a wonderful presentation. And like I said, I'm going to stay on. Thank you for coming tonight. So I will stay on if you would like to complete the surveys. Thank you.
Yeah, it was my pleasure, and thank you all for joining.